Hey guys, what's up? It's Dr. Dylan Greeney, board certified dermatologist, here to help you get your best skin. I'm on this side. Do a little bit of skincare Q&A like normal. I'm also going to be doing some gaming today, so we'll try that out. So I appreciate you guys being here. Any questions you got, all you got to do is drop them in the chat. Again, I studied for 13 years to become a dermatologist, and now I spend some time online chatting with you guys, helping you guys get your best skin. So feel free to ask any questions you got in the chat. Someone asked a question about acanthosis nigricans. So that's like a thick and dark skin that you sometimes get in the armpits, get around the neck, sometimes like little cricks of the arms. You got to do things, one, to maintain healthy insulin levels and not become insulin resistant. So you got to be exercising, eating a good diet. And then treatments that can help that are things like doing amylactin, things that are like alpha hydroxy acids that help to thin out that top layer of our skin. So someone's on testosterone, they're asking a little bit about the back acne. So as you know, our acne tends to get worse in our teenage years, right? So testosterone is kind of dependent on it. Sometimes with testosterone, your skin will get a little bit more oily, things of that nature. So you do, if you're on testosterone, you can break out worse. There's things that can help it. If you're looking at chest and back acne, I would always lean into using a great strong benzoyl peroxide, like a 10% panoxyl or acne-free 10%. Use that on the chest and back just to dry that stuff out a little bit more, help reduce acne bacteria. Mineral chemical sunscreen, as long as you're using SPF 30, that's the key. They're both very, very good. So you can use either mineral or chemical sunscreens. Some people are worried about chemical sunscreen components and their effects, on endocrine system and stuff like that. There's no research to really show that, these chemical sunscreens are a harmful thing to you. So that's the thing, that's been debated a little bit. We do know that chemical sunscreens do end up in the blood a little bit more than we thought, especially if you use enough of it. Mineral sunscreens kind of set more on the surface of the skin. They reflect more rays. So it's up to you. Generally, chemical sunscreens are going to be a little bit more elegant, I would say. They're going to be less likely to leave a white cast. And then Alistair says, babe, wake up. Dr. Green is live on YouTube. Well, thank you for being here, Alistair. It's so good to see you here. Thank you. It's good to have you. So yeah, any questions you guys have, just drop them in the chat. Smile line recommendations for those. You can do things like fillers. Obviously, if it's really bad, you can do things like facelifts, stuff like that. Retinol is actually not really controversial at all. Retinol is probably the second most important thing that anyone could do in a skincare routine to help with concerns of aging, like fine lines, wrinkles, dark spots, and things like that. So there's nothing controversial about retinol. I think just people don't really understand, or maybe there's bad information coming from people with small amounts of training and a small amount of just, knowledge on the subject. But anybody that knows anything about anything when it comes to skincare, and those kind of things, people recommend retinol. Alistair says, any recommendations to reduce facial fat? So there's no real true targeted non-invasive way to reduce fat on any one particular part of the body that's super effective. So, there are things that you can go in. Of course, you can do targeted liposuction, things like in the neck, things like that. But as you lose weight and you burn more calories all over, our fat cells shrink everywhere. So there are people that do surgical types of fat removal, like buccal fat removal, where you'll remove fat from the cheek and stuff like that. But sometimes that's overdone. Or if you lose weight later in life, you can end up with a very gaunt, skeleton-like look, which is not good. So those kind of things can happen. So you want to be very careful about that. I would be a little careful on that for sure, because you can definitely overdo it. How important is a good water filter in a big city like LA? So Connor, you're asking a great question. Some things like hard water, there's all kinds of stuff that can end up in water. That's why they say don't flush prescription medicines. And I think you can only filter out so much stuff. So, any big city is going to be filtering the water, but I think you can't filter out everything. And sometimes some compounds are pretty challenging to get out of the water. So that's something that's a big concern. And I think it's a good idea to have a filter on the water. I have in my house, I have, just a standard water filter on my fridge. But I also have a Berkey water filtration system that I can use if I need to. And then on my showers, I use a Jolie water filter. And the company sent me that, and I've used it. I do think my skin feels a little bit better when using it. And obviously, if you have trouble like hard water and stuff like that, and you're worried about that stuff building up in your hair a little bit, then in that case, it can help you quite a bit. So otherwise, reducing facial fat, you usually don't remove much fat on the face. If anything, most people are putting fat into the face because like under eye hollows and stuff like that, sometimes people do fat transfers like that. But a lot of times people aren't really removing fat from the face. Just normal good weight loss is the key. 90 Soda says, tips for dry scalp and dandruff. My doctor told me to put alcohol on my head. I think that's a horrible recommendation. I'm sorry that they gave you that. I don't think that's ever been a great recommendation for anybody. But if you do suffer with dry scalp or dandruff and things like that, Queen MB, what's up? Oh my God, to you. I would recommend in that case doing something like Nizoral shampoo, or potentially doing like Head and Shoulders or Selsun Blue shampoo. All these things can help. So yeah, I'm glad Nightly Soda, you knew it was bad. Pico laser is one of the best lasers for hyperpigmentation, but lasers are only as safe as the level of knowledge that the person operating them has. You can burn anybody with a laser. You can use the laser incorrectly. You can cause a problem with any laser. So the technical expertise of the person using the laser is key. So thoughts on Accutane at 1. I have a little bit of scarring already. Oh, at 19, I think it says. So Accutane is the best medicine there is for acne, and it's the only thing that can cure acne permanently. So these are really, really good questions overall. But I love Accutane. I use it in lots of my patients. Biologic cleared for 4 months, but now they make me get one twice a month. So yeah, biologics, the only problem is with some of these medicines for eczema, psoriasis, stuff like that, is that they only work when you're using them. They're still not a cure for these problems. Can absence of sunlight affect skin? So Davish. So absolutely. Not necessarily the skin. I mean, your skin doesn't need sunlight to, you don't need sunlight. The one thing we get from the sunlight does help regulate our circadian rhythms. So no one's going to not see sunlight unless you're in some horrible situation where you're a prisoner under the ground or something. I don't know what the hell, but you don't necessarily need sunlight to survive from a skin perspective. But as you guys all know, sun on our skin does produce vitamin D in our bodies. Now, the reality is sun, unfortunately, also contains UV radiation, which is directly carcinogenic. So UV light on our skin does cause skin cancer. So the safer bet is get a reasonable amount of protected exposure to the sun, supplement with vitamin D, and then that way you don't deal with fallout from aging and skin cancer from UV light in the sun. So Alshke says, home remedy for glowing skin. So I have a lot of my favorite options for glowing skin linked in my bio. If you go to my link tree, you could see, actually, I literally have a section like tips, my favorites for glowing skin. I literally have that. But in the end of the day, it's going to be a great skincare routine. And if I was going to break down a great skincare routine for glowing skin, I would say what you want to be doing is you want to be doing in the morning, you want to use a great vitamin C. One of my favorite vitamin C's, and I'll put it in the chat, my favorite vitamin C is Brandify vitamin C. There's a CE ferulic vitamin C from Brandify. I love that in the morning. Another thing that's very, very good in the morning would be doing CeraVe Cream to Foam Cleanser. Now you're gonna, of course, cleanse before you apply your vitamin C. And if you want to get a really glowy look, I would personally use a glowy tinted sunscreen. So like something like Supergoop Glow Screen, that's an amazing one that has a little bit of glowiness to it. So that's going to be your full morning routine. At bedtime, you can just repeat the cleanser, okay? And then you're going to want to use some kind of retinoid or retinol. If you're looking for something, if you got a little bit of acne, you got a little bit of dark spots, you got a little bit of skin texture, then I would definitely lean into doing something like the La Roche-Posay Effaclar Adapalene gel. Or if you're looking for something more gentle, you can get Rock. So the Rock, so you could go with Rock. So as promised, guys, I kind of said tonight today, I'm going to do gaming and Q&A, right? And if you guys haven't seen this, I know YouTube, if you guys are here, YouTube, what I want to say is please tap the like, share this with a friend if they love skincare. For those of you guys who checked out my long form video I dropped yesterday on the supplementation stuff, thank you for being here, YouTube. I appreciate you guys. If you guys want to drop a couple of likes, YouTube, and make sure if you're here on YouTube, just throw something in the chat. Throw something in the chat if you're here. It helps support the channel. I'm going to switch this over. I've got this. If you guys are on YouTube, you've never seen me do this before, but a lot of times when I hop on this, I'll actually play games and answer questions. So it gives you guys something a little bit different to look at. You guys can let me know if for some reason like the game's too loud or something like that. But you just let me know, okay? You just let me know if it is. So I'm gonna go ahead and just start this up. So only downside to tinted sunscreen is it can stay in your shirt. Absolutely, believe me, wearing a white coat, like I've got a little bit of tint on all my white coats, you know, stuff like that. So it definitely can happen. You got to be a little careful with that. I had a couple dogs that were supposed to roll with me. Oh, he's here. The dog is here. Boolong is here, dude. Here, I'm backing out, Boolong. What's up, dude? How are you? Yeah, it's Boolong. Can you guys hear Boolong? Thumbs up in the chat if you can hear Boolong. Alistair liked the transition. Well, thank you, Alistair. I appreciate it. I worked long and hard on that, actually. Do you have any updates or anything? Or are you hopping in? I'm glad you liked it.
Hello, yeah, can you hear me?
Yeah. I don't know. Alistair, can you hear me?
I'm hopping in right now.
Okay, cool. So thank you so much. And yeah, you don't have to use a tinted sunscreen, but I think sometimes for the people who want to, the people that want to glow, I feel like tinted is a little bit better because I still feel sometimes you could look a little ghostly if you end up using. Hey Zaylee, good to see you. So good to see you. Thanks for being here. Good to see you. Yeah. So
hey
Boolong said, "What up?" So yeah, they can hear you, Boolong. So
good.
Yeah, but if you use just like a mineral-based sunscreen, like a zinc oxide, the trouble with that is you can end up with the kind of like that little bit of a ghostly white look, and that can be a little bit of rough, you know, for people. So, yeah, it can be a little bit rough for people overall. Yeah. So what up, B? So yeah, YouTube. If you guys have questions, just drop them in the chat. If you guys are new here, just drop any type of questions you have in the chat. Literally. I'm Dr. Greeney. I'm a board certified dermatologist. I'm here to help you get your best skin. I treat over 3,000 conditions of the hair, skin, and nails. I do 50% of my practice as cosmetic dermatology. So things like Botox, fillers, lasers, all of that. On Mondays and Tuesdays, I do surgery for skin cancer removal. I help cure people from skin cancer like melanoma and basal cell squamous cell. And then I also treat all the other stuff, you know, like eczema, psoriasis. I do skin checks, of course, hair loss. I treat all of that, you know, people with dry, itchy skin, anything, you know, anything skin related you can imagine, I help people with. So dark circles around the eyes, I'm insecure about. So Jonathan, things that you can do for there is things like you can do PRP, sometimes you can do under eye filler if you're a good candidate. You can do laser around there. Those are all good options. Tristan Lambert says, can general surgeon do HS surgery to get rid of granulation tissue bumps? Absolutely. So a lot of these are either done by plastic surgeons or general surgeons, and they can do a really, really nice job on that. So that would be, a great person to talk to, especially if your HS tends to be a breakout, always in the same place all the time. You can have that removed. And then Shar Aka says, is Sculptra a good choice for lifting? So it's not a super strong, lift filler. So it's actually not a super strong lift filler, but it is a nice option overall for anti-aging and stimulating collagen. So for all of those reasons, I love Sculptra. If you're looking for a lift, it's probably not going to be your best option in that sense, but it can help people. So I'm a big fan of Sculptra. So if you guys don't know, Sculptra is a type of injectable that can be used to stimulate collagen in your skin. It's called a biostimulator. So where normal fillers are injected in the skin and they just simply kind of provide a gel and a volume that is going to be temporary and go away with time, that isn't biologically active, Sculptra is actually going to stimulate your own body to make collagen, so that way you age more gracefully and you essentially bank collagen. Because as you guys know, after 20, after 30, we start to, we start to lose more and more collagen with time, right? So we want to do things to stimulate collagen. So, and then Mage says, please recommend some homemade face masks for getting rid of pimples. So you really don't want to use homemade face masks. If you're going to do anything, I would recommend using a good leave-on, like a good leave-on toner with salicylic acid. But the main thing you want to be doing is you want to be using a great benzoyl peroxide cleanser in the morning, like a 4 or 5% benzoyl peroxide cleanser. You can get that from a variety of brands. And then the other option would be doing La Roche-Posay Effaclar Adapalene Gel at bedtime. These are going to be the things that really make the difference for you. Face masks are just a temporary thing that can give you a little bit of benefit, but it's not going to be your best option. So dissecting cellulitis on the scalp, that's one you're going to want to talk to your dermatologist about. Did you guys all go elsewhere? Sorry.
I don't even know where I'm at because I don't know if my shaders were loaded.
Oh, is it all chunky now?
It is chunky.
Oh, okay, shoot. We'll have to get you back on it.
Your squad mate's back on stage.
So I'm over at thing. So yeah, I definitely talked to. I had 2 Sculptra so far and seeing some good results. Refreshing face. You're welcome. So yeah, it's great. I mean, if you're patient with it and know that it's going to take multiple treatments, that's the key when it comes to Sculptra. You know, you just got to be patient with it, and it does a real nice job. Yeah. So you're very welcome. Great questions. Thank you guys so much. YouTube, if you guys can, please, YouTube, you want to get the cards real quick, or are you trying to?
I can't even move.
Okay. You want to just back? Or do you...
Starting to catch up.
My friend is actually not a dermatologist. He is a DJ.
Your squad mate's gone.
He's also got experience in the auto industry.
You got reinforcements inbound.
Auto by day, DJ by night.
That's right. So we sometimes play, well, not in a long time, but we sometimes play with another gentleman who's an anesthesiologist. We play with him a little bit. And yeah.
Yeah, it just kicked me.
Kicked you. Okay, I'm gonna back.
No, let me load my shaders. Oh, I'm playing.
Oh, okay. So let's see. Yeah, keep the questions coming, guys, though. Should I use a toner? So most people don't need toner, but our friend here was asking about the whole idea of like a face mask. So I kind of feel like a toner, you know, maybe they like the idea of that. So yeah, feel free to ask any questions you guys have. Let us know what questions you got about your skin. Literally any question. We talk about everything. Any skincare products you guys like, skincare products you've tried and didn't like. Everyone's always so happy to learn about these things.
Your squad made it to the safe zone.
So how to get rid of melasma? So yeah, melasma, really frustrating condition. It's generally caused from hormones, so usually oral contraceptive pills, or maybe it pops up during pregnancy. Usually comes up as a symmetrical type of hyperpigmentation or dark spots on the face. Very frustrating condition because there's not like a perfect way to get rid of it. What I'll tell you is lasers generally don't work well for melasma, so definitely don't use lasers. Chemical peels are very good for it, and also like prescription medical stuff. Prescription like medical treatments like hydroquinone that are prescription. These kind of things can really help with melasma. So, but you want to see a dermatologist in person to get the best options. But I really like peels for this, and I really like peels, and I really like hydroquinone. So those are good options. You got to use great sunscreen every day. If you're not using great sunscreen every day, you don't stand a chance. Because if you go out and you get sun exposure on melasma-prone skin, it's all going to darken up so fast. Bumba says, do you think detergent and shampoo can be absorbed through the skin, and would you absorb it? So that's a good question. Yes, any of these things can certainly cause a rash on the skin. It doesn't take much to be allergic to something. It doesn't take much to be allergic to something and for it to get in your skin. So that definitely can happen. The question maybe would be with things that certain things like parabens and other preservatives and stuff like that. These can be irritants on the skin overall. They can be irritants on the skin. And then I've seen there's some studies where they can measure the amount of parabens like in the urine and stuff that come from some of our skincare products, which could be things like shampoos or cleansers and things like that. So I guess You know, I don't really worry about it a ton myself, but it's hard because some of these places, some of these other countries and stuff, have banned these products, right? So it makes you wonder when they ban them. Vatama, I've not had great results with, but I think it's worth trying. It's a great steroid-free option for people, which is good. Tiny bumps. I mean, there's a lot of different things that can cause tiny bumps, right? So it just depends what's causing them. It's always a good idea to go see a dermatologist and get an accurate diagnosis, so that way you know kind of what's going on. But the most common type of tiny bumps are things like milia or closed comedones, which are like pimples. And my favorite treatment for both of those is adapalene at bedtime. Adapalene's a really, really good option for it. So that's what I really like. So keep tapping the likes, guys. Drop some likes, drop some comments. Even if you guys are just hanging out in YouTube, drop some comments in the chat, just a thumbs up, anything. Let us know you're here. Just because it really makes a big difference on letting YouTube know that this is helping people. So milia, yeah. So milia, exactly. Small tiny bumps. Ooh.
Contract failed. Objective lost. We lost
Bum, so happy it's helpful. But other solutions that can be helpful for milia are using things like salicylic acid cleansers. Salicylic acid is a type of beta hydroxy acid, and beta hydroxy acid can kind of get down into pores and help to break up they can get down into pores and help to prevent buildup and blockage of pores. And then your adapalene that I've been telling you guys about, that once again makes skin cells less sticky and less prone to blocking pores. So, but you guys are incredible. Thanks for being part of this community. Again, for those of you guys that don't know me, I'm Dr. Dylan Greeney. I'm a board certified dermatologist here to help you get your best skin. Acne on the shoulders is very common. Acne comes up mostly in places where we have oily skin. So we see a lot of acne in places where we have oily skin.
Enemy movement.
I'm scared. Because acne bacteria metabolizes skin oils. You know, so our chest, our back, our face, you know, all very oily areas where you can get acne to come up. Tips for keloid scar after surgery. There's a lot of different. So a keloid scar is essentially a scar that's bigger than the area of the wound. So say you have a cut. Say you have a cut. You have a cut that's on your skin, and then you get a really, really big scar that's thick and, you know, angry. Sometimes it's very sensitive, that kind of thing. So ways that you can help keloid scars is the most common way we treat it. We actually inject it with steroids, and steroids, a side effect of steroids is called skin atrophy. And skin atrophy that's basically a shrinking of the skin. So we'll inject it sometimes with steroids, or sometimes I'll use a treatment called Effudex. And Effudex is actually a type of actually chemotherapy medicine, but it helps to slow down like these kind of rapidly dividing cells, and it can shrink down scars, and it really does a nice job even in 1 or 2 treatments. But also things like radiation Sometimes when you have really bad keloid, that can help. It's really good. Hi, just joining and confused what's happening. KB, don't be confused. I'm just answering you guys questions like normal, as you guys know. And I'm answering those questions. And I'm also... Can't see anything. And I'm also playing games. So this is something I do. And Cindy, thanks so much for subscribing. If you got any questions, just feel free to ask. Cindy says benzoyl peroxide is good for acne. It's wonderful. On the chest and back, I recommend you just using... if on the chest and back, I really recommend just... I'm out of ammo. Oh, no. Oh, maybe there's some here.
Bounty contest. You're being reassigned. Your priority is taking out the target.
Could you submit cal rounds?
So a 4 or 5% is great. A 4 or 5% is great for the face. And a 10% is really good for the back. Oh no. I'm down. All right. So that's a good question. But benzoyl peroxide is the favorite thing that I generally put into skincare routines. I really like benzoyl peroxide as my favorite over salicylic acid. But if you have predominantly open and closed comedones, whiteheads and blackheads, then I actually like salicylic acid a little bit more. But benzoyl peroxide is very good. Audrey says, how long would you wait for surgery to recover before doing something for the scar? I mean, it just depends. If you're getting an obvious keloid, if you're getting like a very obvious keloid, I would go ahead and treat it anywhere like 4 to 6 weeks sometimes, but know that generally most scars aren't really going to be fully healed for about 1.5 years. But if you know that scar's misbehaving, you could treat it a little bit earlier, right? What do I do to heal my cuticles if they're infected? You could do things, look up like vinegar soaks. You could do like where dilute white vinegar and water and warm water, and you can kind of put that in there. How to treat both comedonal inflammatory acne. Patricia, again, using benzoyl peroxide cleanser in the morning and adapalene at bedtime is about your best bet. If you guys are wondering how to treat acne, if you click the link in my bio and go to acne routine in my shop, I have a whole acne routine right there for you. It couldn't be any easier. So can vitamin C serum cause you to break out? It definitely can, Easton. You can get some breakouts from vitamin C. There's some vitamin C's like the one from Brandify, the Silymarin one, Sily M, that you can get, and it also has salicylic acid in it. It makes it less likely for you to break out. And then Bulong, what's your status, bro?
Doing shaders.
Still doing shaders? Okay. We're just chatting here, so you're good. Is azelaic acid good? I really like azelaic acid for hyperpigmentation. It's also good for rosacea. So there's a lot of things you can do. I really like azelaic acid for those reasons. Azelaic acid is also safe in pregnancy. So for women, that are struggling with a little bit of acne and stuff, and they're pregnant and they want something that's safe during pregnancy and maybe during breastfeeding, then azelaic acid's a wonderful touch. You can get a really good one from The Ordinary, which I really like. T-gel is a great shampoo, especially for dandruff, for psoriasis, those kind of things could be helpful. So you can get, where am I from? I'm from Evansville, Indiana. So I'm in the Midwest in the United States. Let's see. Ingredients good for melasma. So Cindy, if you're looking for anything good for melasma, I would check out one of my most recent YouTube videos. It's not the most recent one I did, but actually no, I didn't do a video on that. But the same brand, the Remedy for Healthy Aging, there's one called Remedy for dark spots, and that product in particular is probably the best thing you can get over the counter for hyperpigmentation. So if you're struggling with melasma, you're struggling with dark spots, hyperpigmentation, then that's going to be the best thing you can get over the counter. And it's only about $30, $32 or something. But when you use that, you're getting like 6 different ingredients for hyperpigmentation all in a single formula. So I would definitely recommend looking into that. If not, of course, you can get prescription stuff from your dermatologist that's maybe better, more powerful, but for over the counter, you can't really beat that product. So Audrey said, is there anything like lotions, creams to put on it to help from the itchiness? So Audrey, best bet, if you're dealing with scars and you're looking to put something on it, your best bet is going to be applying silicone gel sheets. If you look on like any website, Google it, you know, silicone gel scar sheets, silicone scar sheets. You can find those, and those are really, really good options. Cindy, I'm not sure, you know, like where in the world they ship to, but in the end of the day, if you can get that product, that's your best bet over the counter. Other good ingredients are things like kojic acid, azelaic acid, alpha arbutin, hydroquinone. But again, one of the problems is sometimes if people get like unregulated, unsourced hydroquinone from places, you know, from places like, you know, overseas, or you don't really know how to use it, or you use it too long, you can actually get problems from that. So some of these things you don't want to just do rogue on your own. You want to be careful with that. Okay. So I'm using Tret, but still breaking out. So you definitely want to be using tretinoin for 3 or 4 months or more to even start seeing how good it is. Yep. A month is nothing. So if you're using tretinoin for a month, you're just getting started. Just settle in, enjoy the ride. You're going to be doing that for a while. It's going to take at least 3 months to kind of see a difference. So keep it up. How can I treat sebderm? I know it isn't curable, but managing it. So I would use things like Selsun Blue shampoo, leave it on, lather it up, leave it on your skin 2 or 3 minutes, then rinse it away. Do that 2 or 3 times a week. Zamo is I had a breast reduction about 7 months ago. Do you recommend bio oil on the scars? So we were just talking about that Zamo. I'm actually not a huge fan of bio oil. My favorite option would be doing silicone gel scar sheets. You can get those online. They're easy to find. On your upcoming video, please rescale your skincare routine. So I actually have done a lot of videos on that. If you just look back, I've actually got my full skincare routine in a video that's very high quality. If you look at, there's a video that I have, let's get the best skin of your life without breaking the bank. That is basically my skincare routine. So I just do that. Terry, I would say if you got bumps that are bothering you, I definitely like go see your dermatologist, and so you can figure out what those bumps are and get them treated if they're bugging you that bad. That's what I would that was what I would do, because there's not gonna be anything you can do over the counter for that, right? Do you have a name brand of silicone? I don't have a name brand of that, Macy. I think you just can find one, look at the reviews, find one that has good reviews for you, and that's the way I would go with it. You guys are asking awesome awesome questions for sure. So thank you so much, YouTube. I really want to shout you guys out. Thank you so much for being here. You guys are awesome. It's fun to do the gaming Q&A and live together a little bit. So I appreciate you guys being here and asking so many great questions. If you guys don't subscribe, feel free to subscribe. It means the world if you subscribe. Definitely tap the bell so you know when I go live, when I drop a new video. You know, I dropped a great video yesterday that was more about health and wellness than about skincare. But in the end of the day, you got to have a healthy body to have good skin too, right? So it's kind of all tied in, right? Our systems are not just individual organ systems. Like we're a whole person, and everything that we do makes a difference for every other body part. So check that video out if you haven't. So what can I do about hairline acne? So Gabriella, if you're getting a little bit of that stuff in the hairline and the scalp, there is a pretty nice shampoo called CLN shampoo, and like clean CLN shampoo, and you can use that in the scalp to kind of get rid of some of those hair bumps. And Cindy, you're very welcome. I'm happy to help you. So thank you. Crystal XOXO says, bruh. What's up, Crystal? What you bruhing me for? Chin acne? So we're going to treat chin acne the same way we treat all the other acne. You're going to want to use benzoyl peroxide 4% cleanser in the morning. So I would probably get it from CeraVe. At bedtime, La Roche-Posay Effaclar Adapalene Gel. Again, if you forget, those are linked in my bio at my Shop My under acne routine. Now, as a woman, Crystal, the lower face acne a lot of times does tend to be hormonal. So sometimes you need prescription medicines for that, whether they're oral prescription medicines or topical prescription medicines. There's a lot of different ways that you can do that. So there's different options, but of course those are prescription. So there's not going to be any particular thing you can do over the counter for hormonal acne, but the treatment regimen that I just gave you can really help any kind of acne, hormonal or otherwise, and help get it under a little bit better control, but you might need more. So that's, I hope that helps you. Tretinoin purging, if you have it, it's usually going to be like a 3 or 4 week thing. It's more usually just dryness and irritation that comes with the acne treatment more than actual purging. So purging is kind of hyped online, but yeah. So thank you so much. I appreciate you guys being here. What about little white dots and pimples around the mouth and lips? Can happen, right? You can get those bumps. They could be acne. They can be little milia. anything like that. So that little salicylic acid wash is the way to go. If you're looking for something very, very mild for kind of those little tiny pimple bumps, I would lean into the Vichy Phytoderm Normal Active thing. Scabies, Gabriella, you're welcome. Happy to help you. Yeah, anything get rid of cherry angiomas. Yeah, right now the record for cherry angiomas, I removed 177 off a lady with laser, and it's literally just as much as putting a little dab of gel on it and zapping them with a laser, one zap each, and they all go away without leaving a mark. So that's so yeah, you can do that. Panoxyl is a wonderful treatment. Yeah, I love Panoxyl. It's very good. A lot of other people make that though too. You don't have to get it from Panoxyl, but CeraVe makes a great 10% benzoyl peroxide wash. Acne Free makes a great one. There's other options out there too. So yeah, that was a nice gaming section. You don't see dermatologists answering questions and gaming on YouTube often. No, I think it's a pretty rare niche. If Boolong had updated his crap when he was supposed to, and Jackson had, we'd have 2 dogs rolling with me. We'd be gaming. No, dude. All you gotta do is open your game, bro. You're killing me.
Beef tallow in your mouth.
It's not like we didn't plan this. So yeah.
I wasn't even at home.
Dude, excuses, bro. All right. Do I got to roll by myself right now?
I'm at 90.
Okay, I'm going to wait. All right. So we're going to get back on. There will be more gaming. I promise you. There will be more gaming. So if you guys are on YouTube, go ahead. What'd you say?
Zaylee's laughing at you.
Oh, Zaylee's laughing. Well, she's laughing at you, man, because you came in unprepared, bro. So yeah, we're going to game more. We're definitely going to game more. Invite your friends. If you guys are on YouTube and you don't subscribe, please subscribe. I'm begging you to subscribe, because I want to do more on YouTube, but I got to feel the love, and I actually feel the love from the chat. Like Alistair is literally been here every live. Alistair's amazing. So thank you, Alistair. Shout out to you. Cicaplast Balm B5, is it a good moisturizer? It's an exceptional moisturizer. It's so good. What if you pull off a skin tag? What would happen? It would bleed. Gabriella, thank you for the pumpkins. You're awesome. Happy Halloween. Do you just have TikTok and YouTube aside from Discord? Dude, I get everything. I'm on X. I'm on TikTok, YouTube, Instagram. I'm everywhere, Zaylee.
Celebrity.
I'm everywhere. I'm not even a celeb though. I'm just a normal guy out here. I put my pants the same way as Boolong, one leg at a time. You're good?
Yes, sir.
Okay. So La Mer moisturizer, La Mer, way too expensive. I think you're low-key a little crazy if you buy it. I think it's crazy, but if you love it and your skin's looking good and it's not breaking the bank, you're putting food on the table, then go for it. No problem, right? So no problem at all. If you like it and it's not breaking the bank, but I would never, if you guys know me, I really only recommend skincare products that are affordable, that are safe, that are easy to find. I don't want people spending crazy money on skincare. I'm not really about that. So I want, I want people to get stuff that's going to help them. If I recommend a product, it's because I love it, because I've tried it. There's a lot of times you guys ask me about something. I've tried nearly everything, but sometimes you guys ask me something and I'm like, I don't know. I haven't used it, and I'm never going to like pitch products that I haven't personally tried. I'm not going to pitch products that I've used and I don't like it, or I don't agree that the ingredient label, if it doesn't seem like it's going to be effective, then no way. Brandify is goated. Zaylee knows. And again, if you guys want to do, that Brandify, if you use that Greeney 40 on the website, you already know you get 40% off. I don't make any money from that. I do help Brandify formulate their skincare products. Is this sponsored? No, it's not sponsored. I'm just trying to tell you guys how to get good skincare that's affordable and very good. Yeah, that's what I'm here for. So drop questions in the chat, guys. I need questions in the chat. We are still gaming. We haven't stopped. New game's about to start, but I'm glad we got to sit here and answer questions for a while. Make sure to share the live, guys. If you guys are here, share the live. I haven't tried the PHIX. I haven't tried that. Minoxidil beard growth, absolutely. Doxycycline or tretinoin, they're completely different. I mean, one's an antibiotic, and both of them can help acne. tretinoin, if I could only pick one, would be my option because it's something that you can do long term. Most people don't want to be on, you know, you don't want to sit there and be on doxycycline for your whole life. Now, sometimes my patients, they want to be on it. You got things like rosacea and acne and you need it long term. Sometimes you do need that stuff, but yeah. So freckles on Accutane. I think someone asked me about that. Audrey, did you ask me about that the other day? Certainly, Accutane does not cause freckles. And it's kind of unrelated to freckles. Some people think Accutane maybe does increase your sensitivity to the sun a little bit. Would you say top floor?
Yep,
Top floor. I'm with you. I think I heard him. Yep. He's cracked. Jump. Woo. Is he at the stairwell? He's cracked.
Tossing a decoy.
I need like a little bit of ammo. We just hold here or what? I'm plating. So yeah, freckles and Accutane. You can hear him behind us.
Go up or down? We need to go up.
Let's go. Up's gonna be so dangerous, bro. But let's do it. No, go down. Okay, I'm with you. I'm with you. Down, down, down. I think they're in their building. We just came. Probably. Oh! Got one down. One thirsted.
Operators from that squad. Hunt them down.
Visual. One enemy.
Got him. Oh, dude, the other one got me. Crap. The guy that downed you, I ended up getting him. But so it says probably, but I've never had them the entire. But I got them when I was on Accutane. Yeah, I don't know, man. Did you get more sun, Aubrey, over the summertime? You know, is that what happened? Maybe, I don't know.
Go get after
But
Well, on the team.
you said what, you're going on the team?
Yeah.
Okay. Yeah, I don't know if it was just
Hostiles deploy a mosquito. Hostile traffic UAV overhead.
great. I broke my leg. I don't know if you can get me up or not.
I'm dead.
When you come back, maybe you can get me up. I don't know. No, they're coming for me, I think. I hear things. Maybe you can get me, bro? I don't know. Let's see. Does skin become dark when you turn 42? Drier. Oh, you definitely skin get definitely drier. You know, you definitely feel less moisturized as time goes on. 100%. So a lot of my older patients are definitely not complaining of oily skin. You know, it's a little bit rare to be complaining of oily skin like later in life, I would say. But it's a good question. You know, that oily skin when you're younger, you know, a lot of people hate it. But I feel like my more oily skin type patients generally have fewer wrinkles and signs of aging overall with drier skin. And then also the unfortunate reality is like my patients that are a normal healthy body weight as well,
your squad mates back on station.
they tend to show signs of aging a little bit more too, which is really the bad part about the whole thing. Yeah. So keep the questions coming, YouTube. Let me know what you got.
Enemy marked.
Are they on you guys or where they at?
I marked one behind, but looks like one dude's pushing towards control. I'm coming to you. Loadouts, yeah, sweet.
Headed your way.
Best moisturizers for oily skin. Just a lightweight moisturizer, something like CeraVe moisturizing lotion would be a good option.
It's from the shed.
Yep, I saw him. I put a couple shots on him there, but I think he's gonna win this one.
There's a whole squad.
Oh, really?
Yes.
Got
I'm going in the
reinforcements
water.
inbound.
Go in the water. So PDT can be really helpful for treating precancerous lesions. clearing up like large areas, you know, of that. Oh, thank you so much, Not a Dermatologist. Good to see you here. I know you've kind of hung out on YouTube some too, so thanks for coming on over. Not a Dermatologist. Good to see you. I saw you helping with some of the questions in the chat too, so thank you. Oh no, Cole, you can ask any questions, honestly. Why did your dad leave?
Stay alive to bring 'em back.
It's really tough, man. I'll tell you this, it didn't have anything to do with you, brother. You know, I grew up in a household, my parents were never married. I didn't see my dad a lot until I was, I don't know, I think I was like 5 or 6 before I started to see my dad again. And then now me and my dad are pretty close and everything, but for the longest time we weren't.
Marking the rest of that squad on
So
your map.
Sniper long on the loadout.
Use some
oh, okay,
extra
yeah,
rounds.
I see.
Moving.
So what is a great product to use for shingles that prevent flaring? So shingles is very rare to flare more than once in a lifetime unless you're immunosuppressed, just so you know. But things like cold sore virus, like HSV, you can take supplements like lysine that sometimes can help people. But more importantly, taking antiviral medicine is the best way to do it. Something like valacyclovir or acyclovir, that's a really, really good option for people. And depending, usually as a doctor, we'll say if you get more than 6 flares a year, then it's worth being on a preventative antiviral.
All right, your squad's in the safe zone.
That's a good option for you. So let's see, we got other questions here. So I would definitely give it at least like probably a good 6-8 weeks before I would get eyebrows waxed after Accutane, because your skin is going to be very, very sensitive right after Accutane. So I wouldn't get into that right away. So following questions earlier, would an ER general surgeon be able to do HS granule? So ER docs are not going to be good for treating HS. That, you know, by definition, an ER doctor is treating like acute conditions that are actively flared. You need someone who's going to be treating this incredibly long-term chronic problem that you have. So an ER doctor is not the right person for you in this case.
Moving here. Enemy here.
There's one down at the boat there. So an ER doctor, I would not have them do that. I'm almost done with my book on eczema. I added a chapter on mental health stuff last night. That's awesome, Not a Dermatologist. You're definitely gonna have to let me know when that drops. I'm super excited to get when you get that done, and you got a wealth of knowledge with, you know, your family, you know, fighting eczema this whole time. Multiple drops behind us too. There's 2 at least behind us over here. Now there's a whole squad over there. So yeah, we probably should push forward. There's people below us too on the boat. Oh shoot, they're right behind us.
Get ready, resurgence window's about to close.
They're looking at us again from behind.
Fire.
I'm moving to control, but control's hot too, so careful.
Controls out of the circle too. Watch out.
Yep.
There
I'm
we
down.
go.
I'm down.
Crap.
So let's see. Okay, other questions. So home microneedling, is there best time to do it when preparing for a big event like the week before or an event? Well, I would definitely, anytime you're going to add stuff to your routine, try to do it like, you know, try to do it for a little while before your event. So I wouldn't be adding anything new a week before. Now, microneedling, you're going to heal from very quickly. I mean, you're only going to be irritated from microneedling for probably maybe 3 days at the very most. But could you get a little breakout or something like that happens after microneedling? Possibly. So I would start it, you know, about a couple months before, and then you can get an idea for exactly how long it takes you to heal, you know.
Fire sales done. Prices are back to normal.
You're fighting at control. I'm going to go get my stuff.
I'm in tunnel.
That's on me. Jeez. Our boy was here, and let's see. Does blue light emitted from phone or computers affect the skin in any way? So it's probably a relatively low amount of blue light. So it's a very small amount of blue light that you're actually getting. The biggest emitter of blue light by far out of anything is actually from the sun. So, but blue light does influence hyperpigmentation. So it definitely influences hyperpigmentation in a big way. So, if you use mineral tinted sunscreens, you're going to protect from blue light from computer screens, from lights indoors, from your computer monitors and things like that. So we got one right above us, two right above us. One down. Yep, good, good. A little bit of this ammo, gas mask.
You down?
Selfie kit. Good. Nice work. So yeah, so you definitely want to protect from blue light up top. Saw one up here. Yeah. Also on the prison.
Move to the safe zone.
There's people, you know, at prison.
Yeah.
Inside there.
That got me. I don't know how that got me.
The precision.
Yeah.
Yeah.
You give me?
I'm moving up. I'm moving up to you now. The boys are too. It hit me and it just almost got me. I think are they on the roof with us? Oh, yep, he's on the roof. Nice job. So, do you sleep on your back, doctor, to prevent from getting smushed? So, I have really bad sleep wrinkles on both sides of my forehead. I have two over here and I have one over here. I'm a side sleeper. I hate it. I cannot break the habit. I'm so bad about sleeping on my side. Thank you, bro. So bad about sleeping on my side, but I do it. And I'm trying to break that habit.
Gas is moving.
Trying to come in hot, bro.
The safe zone is far from your location. Get moving, pronto.
What am I doing when I picked up this crappy gun? I think I got you. So yeah, side sleeping definitely causes some wrinkles that can be really tough to treat. You okay?
Yeah.
Couple contracts out there have increased payouts. Get to them first to cash out. Safe zone's a ways out.
Pop our boy back. Chrissy, I'm glad you like it. Thank you, Chrissy.
I didn't know he was
I'm
right
sorry.
there.
I didn't hear anything. Did he get you off the roof?
No, he's on the floor. He's on the ground.
The
with us.
floor? Oh, right there on us? Oh my
Yeah.
god. Oh, dude. Weak. Do you need it back at all or just going?
No, go ahead.
Let's see. Okay. All right. So let's see what other questions we got. So not a dermatologist says zinc helps protect the skin from effects of blue light. I use plain zinc in my skincare routine, but it doesn't substitute sunscreen. Just an added protection on days I'm indoors. So totally. Yeah. I mean, the sunscreens I use are hybrid. So they have zinc oxide in them. But then they also have a chemical based agent too. And I really love the you know, I always use scented sunscreens pretty much. Sanja, thanks so much for being here. Good to see you there. Hello. And Alistair says, I see, thanks for the tip. So yeah, I love when you guys help each other in the comment section too. It's awesome to have you guys. It's awesome to have you guys both here and, you know, like helping one another, you know. It's very good. And thank you so much, Sanjana. Thank you. Love from India. And Cardona, thanks for being here with the yellow hearts. So let's see what other questions we got. What to do with acne scarring? So peels, microneedling, sometimes they can actually be numbed up and taken out and sutured up nicely. Millie under the eyes, really common area. Make sure you're not using too much heavy ointments and stuff under the eyes. You want to kind of avoid that. Be careful with that. You can go to dermatologist and we can, you know, very easily kind of poke and express those. Sunburned turned into a mole freckle like 9 years ago. Should I be concerned? It's always a good idea if you're worried about a new mole to get it checked out. I would say it's worth getting checked out and looked into. But areas where you do get that kind of sun damage, you are more likely to get, you know, moles and problems, right? So I'd get it checked out by a dermatologist. It's hard for me to say one way or another if it's harmful, but if you're worried about it, get it checked out. I moistured it, or sorry, I saw someone ask me a question about moisturize. I moisturizer for 80-year-old, I would get La Roche-Posay Triple Repair Moisturizer. It's very good. It's very rich. I think that's a really, really good option. Why does the left side break out more than the right? I think it totally depends. It could be the side you're sleeping on. If you're doing things like, depending on what your job is, if you have mechanical stresses on one side of the face versus the other, that can kind of do it. Tretinoin for maintenance, I would try to use tretinoin every night if possible. And I majored in biology. I was a biology major. I was a minor in chemistry and economics. So all good questions, guys. If you're on YouTube, please tap the like. Just take 1 second to tap the like. If you're on YouTube, make sure to subscribe. If you guys don't subscribe, please feel free to subscribe. Are we going to yellow?
Yeah.
Yeah. Okay.
Sure.
Okay. Oh, that's scary there, dude. I do not like it, bro, there.
Hostile guardian has been destroyed.
Throwing flash grenade.
Marking the red zone.
So let's see. Do sleep wrinkles need to be treated in a specific way, or are they usually treated like any other wrinkle? Microneedling and things like that can help it. The weird thing is most wrinkles that we see on the face, most wrinkles that we treat on the face are treated with Botox, right? We use a lot of Botox for wrinkles on the face, particularly the upper third of the face. And sleep wrinkles, unfortunately, because they're not from muscle contraction, those are not helped with Botox. So that's the one thing that it doesn't help at all. So you do have to treat them differently in that way. You can treat them with laser, you can treat them with microneedling, things like that, but you cannot treat it with Botox. A dermatographia cure. So dermatographia, there's not like a perfect cure for it by any means, but you kind of treat it similar to hives. So you pretty much treat it with things like antihistamines is going to be the main way. What are called second generation antihistamines, things like Zyrtec and Allegra, Claritin, those kind of things is really your best option. It's not perfect, but it can help. So Dean, that's a good question, Dean.
Earn this. 25 remain. Solid work so far. Your squad mates redeploying. Well done.
So, oh, you're on Xolair. Wow, so you really leveled it up. So, yeah, you're pretty much on the best stuff, Dean. So, the Xolair is your buddy, and I hope that helps you a lot. Definitely takes a while to get to the point where you're trying Xolair. So, that's overall going to be your best option. So,
Enemies dropping into the AO.
bunker buster, dude.
They're coming down the stairs.
Which side?
They're from the roof.
Okay. Wow.
Squad mates. Contract failed.
They're tearing us up, dude. I was using the CeraVe SA cleanser because my pores appear to be clogged, but it got worse. Well, you might get a little bit more irritated, maybe. I mean, your pores aren't going to necessarily get worse, but your skin might get a little bit irritated and dry. I would just kind of back off. If you're using it twice a day, go once a day. If you're using it every day, go every other day. Something like that, and find a happy medium. And Cardona, you're very welcome. I'm so happy to help with any way I can. Again, for those of you guys just meeting me, I'm Dr. Dylan Greeney. I'm a board certified dermatologist. I'm here to help you get your best skin. You want to go over to bio?
Moving.
That's a prison.
Mark the targets.
Your squad mates redeploying.
I don't care. The chance of remission, don't know if I can tell you exactly on remission, but just like chronic urticaria, there is a burnout, you know, factor of it. So it doesn't last forever in everyone, but the people that do have sometimes chronic versions of it, they're on the loadout. He's white. He's down on blue. If we can finish him. Oh, thank you, bro.
Plenty charge.
Recon drones caught your position. You're compromised.
No, he's not dead yet. That's all.
Wow. There's a cluster mine on the loadout too, so be careful. So let's see. What's the difference between a regular dermatologist and a board certified dermatologist? Well, the thing is, there's a lot of people out there that kind of like masquerade as dermatologists. So nowadays there's a lot of people that are maybe their PAs or their NPs or their family doctor, and they hang up a sign and they say dermatologist. In some states that's illegal. In some states that's not. But if you're seeing a board certified dermatologist, then you're seeing somebody that has passed the actual board exam to become a dermatologist and prove that they have competence in all these conditions of the hair, skin, and nails. There's a couple different governing bodies that can kind of give you a board certification for it. The biggest one is the American Board of Dermatology. And then you'll usually see them, they'll say like AAD, which is American Academy of Dermatology, or the ABD, which is American Board of Dermatology. This is not good, bro. We could hit the zip behind us, maybe. Oh no, they're up top too.
Yeah, one with the border.
Okay, nice. I have no plates, sadly.
Get to the safe zone.
Oh, there's a plate. There's another one. Hitting the zip, bro.
Your squad mate's back on station.
I think I'm gonna go to well, I want to go to chemical. Oh, they're zapping me, bro. I'm going to water tower first, dude. I made it halfway across the map just so I wouldn't be able to get res. My sweat is color, but no one else could tell me why. Any idea? So there's a couple reasons you can have colorful sweat. The only one I remember off the top of my head is that rifampin. Rifampin is the type of antibiotic that's pretty rare for most people to take. We don't use it a ton, but it can make your sweat kind of orange color. So that's something that potentially could be happening, possibly.
Resurging. Go get your revenge. You've got reinforcements inbound. Fire sale.
Hot.
Yeah.
Have been reduced.
Enemies deployed a counter UAV.
But if you run into this door, once you get it, I got a suppression on there in case anybody's chasing you. I'm actually watching loadout right now. I'll put smoke on it. Okay, smoke's on it.
Oh, dang it.
One on the water tower, but I've got him. I got you covered from that side.
Back in.
He's white. Try to see. There's one on the water tower still. If you want to go for it, grab it. I got it covered. Go for it.
I already got it.
Oh, you got it? Okay, sure. All right. So,
Your squad mate's back on station.
green to blue to yellow. Wow. So yeah, I've never heard that before. So that's a new one for me. So, you could probably get on Google and go to PubMed and probably get a or a Google Scholar and look up sweat color and see if you can find some reasons why that would be.
Gas is inbound. Your squad's
If anything, it would usually be probably some high consumption of something like a supplement or medicine. I just started on Accutane 40, and I want to ask if I can still dermapin my nose at home with short cartridge like 0.25. To be honest with you, I don't see how it'd be a problem, but there's some people that would probably like be very, very cautious with it, but I don't think it would be any issue at all if you were to continue doing that. But so this is LC, right?
Oh, we can do one more.
You sure?
At least another hour, dude.
And now we can't do another hour, bro. I didn't even hear you pop in the chat, Jackson. I didn't know you're here.
I just heard.
Yeah, I've been waiting an hour, but
Oh my
you guys didn't invite me, so it's okay. I'm just
No,
kidding.
yeah,
No, I was waiting for my download. It was horrible.
Yeah, slow. So yeah, chrome hydrosis is kind of like a word for, you know, the color of the sweat changing. So yeah, that would be the name you'd want to look up, and then you could look at the actual specific reasons for why people get chrome hydrosis. You also get bromhydrosis, which is like more of a
Custom weapon
You
here.
want to go to grandma's or what do you want to do?
sure. Our boy's on there. Top. He's cracked. We're all right. He's on top of the prison.
Well done.
Alright, go inside the grandma's.
Yep.
Gas is moving.
No, my own.
One game, literally. Will they have time for it?
Be advised. You still have
Requesting
squad
recon.
mates
No, we'll have to get back on sometime, Jackson. Do it. I keep getting epidermoid cyst on my face. Currently, I have one really inflamed. Steroid injection doesn't work. Right? Yeah, your steroid injection is going to just give you a temporary improvement, but unfortunately, you have to actually cut those out to get rid of them. Some people are a little bit more genetically predisposed to get those, and it's probably nothing you're doing. The one factor that could be possible is Riley is if you're a smoker, that can make it more likely because it can cause more inflammation around hair follicles, and that hurt. Oh, behind us. Oh god, there's two.
Taking fire.
Oh, that was ulti.
That was a lot. Yeah, it was a lot. They were technical, bro. They came in hot. So if you're a smoker, stop smoking, because that can make like cysts and things like that worse. Okay, I'm gonna back us. We're gonna get Jackson in. Oh, I was on cam only the whole time. So yeah, sorry guys. I meant to have the game pulled up for you guys, but I was focused in, so I forgot to switch it back over. But yeah, so we got Jackson here now too. So Riley says not a smoker, only 20 years old, and I had one on the bridge of my nose, and I keep getting inflamed, and then it would burst and drain. Finally, it didn't come back. Now I have one on my cheek. Well, I'm so sorry. And the other possibility is like, is it just bad acne? You know, Riley, is it bad acne, and you're getting those like, you know, those bad acne bumps, and is it more something like that? Because that's a possibility too. But yeah, really good questions overall, guys. Thank you guys so much. Again, if you're on YouTube, if you haven't yet tapped the like, if you want to tap the like, that'd be awesome. Clay, I'm doing great, brother. It's good to see you. Ellie, it's not pre-recorded, but it's a good question to ask. How to treat keratosis pilaris. So amlactin, I really like it. It's a lactic acid moisturizer. Can kind of help gently chemically exfoliate the skin, and it's good. Do you think the meds they prescribe are good? So pretty vague question. In general, am I happy that we have access to prescription medicines? Yes, they are good. Best treatment for molluscum contagiosum. Honestly, my favorite treatment in the office is doing something called cantharidin. It comes from a beetle called the blister beetle, and you just put a little drop of that on the molluscum, and it irritates the skin and get rid of those. And your skin will naturally clear molluscum, by the way, even without treatment. It just takes some time. Carly asked about the best product to make your nails grow basically long and healthy. And there's a nail lacquer actually that you can find online. Let me get the name of that again. It's you see what it's called. See, I always forget the name of it. A lot of people ask about that. Some people swear by Nail Tech, and it's Nailtek. That's not the one I'm thinking of though. Oh, I think it might be this one. I'm trying to look here and see. There's one called Nailtek's Formula 2. Nailtek's Formula 2, and I think some people really like that one too. So let's see, not connected, but it was recommended to get on Accutane. Not looking to do that. What other suggestions? So yeah, you can. Your other option is going to be treating it like acne, right? So a 5% benzoyl peroxide wash in the morning and La Roche-Posay Effaclar Adapalene gel at night. If you can't remember that, then I would just hop in the link in my bio, and you can go to my acne routine on my ShopMy, and you'll be able to find the routine right there. So that'd be easy for you, Riley. Live in a high altitude, very cold winter. How can I get the most moisture? Make sure you're taking good like fish oil. Take some good fish oil, just like a reasonable dose of fish oil. Make sure you're moisturizing your skin, particularly after showers when your skin's so moist. Sleep with a humidifier in your bedroom at nighttime. Those are all good options. So that's the thing I'd look into. So really good questions, guys. Thank you.
Stay alive to keep your squad in the fight.
Bioweapons, top floor. Let's see here.
All right, we got you started. You finished the job.
Got a little boards on these fat downloads.
I know, they're constantly big fat downloads, and they're like huge. Top floor?
Yep.
Okay. I think Mewtwo went roof.
Oh,
Keep it tight.
Got one on our floor.
two
Yeah.
more shots, I would have killed him.
Okay. Do you want to push roof or no?
Yeah, you can. It's just one dude with a pistol, has no plates.
Removing it. Removing.
Got reinforcements inbound.
Okay. There we go. You're safe to come roof, Jackson, if you want. Let's see. All right.
Looking for plates.
Yeah. Over-the-counter remedies for psoriasis, pretty much just using things like
He's second floor.
That's rough, bro. He's oh. You watching that? I'm with you guys now. I think he retreated and went back downstairs. Plates if you got them. Okay.
Sure down.
There you go. There's plate.
Enemy soldier incoming.
Probably back on the roof again.
Moving this way.
Pings on him. Load out of docks.
Here.
Hostiles deploy the mosquito.
Where you guys at?
We're looking over towards chemical right now. So,
Come down and get cards. I'm gonna put
okay, I'm coming to cards.
precision on them.
Okay, we're down here, Jackson, to get cards. So, advice for topical supplement to help its skin elasticity when losing weight. Silver.
Platinum.
Oh, nice.
Gonna
We'll
go
use some
back.
intel rounds.
Squad's in the safe zone.
Silver.
Silver, okay. We going backside? Yeah, we're going backside. So, there. I don't know if there's a great supplement, honestly, to like help you there. I would say just eating a good healthy diet and making sure you're not crash dieting, kind of taking it slow and steady on that front. Here, Jackson, here's a gun for you too.
I don't have enough money.
For the weapon.
Well, yeah, for the Lodi.
Oh. Oh shoot. Dang. Yeah.
You spent it.
I did spend a little bit because I bought 2 guns like an idiot. We can go to that. Let's go to that loadout though right there. I got smoke.
Yeah, I was like, why are we buying weapons?
I don't know. I'm dumb. So let's see. Is 0.1 tretinoin? It can sometimes help. It definitely can help it. So the guns on the ground, Jackson, you can take any of them. 'Cause I got mine.
Contract is compromised. Stand down.
Does the sun cause skin cancer? Yes, 100%. Absolutely yes. There's no mincing words. There's no doubt about it. The sun is filled with UV rays which cause genetic damage that lead to skin cancer. Where do you guys want to go?
I want to clear docks real quick.
Okay.
Car marked.
So what other questions you guys have? Any YouTube, you guys got any other questions? If you guys want to, now's the time to ask.
Counter UAV is active.
Mewtwo, I'm marking a
Send revive
selfie
kit
for
here.
you.
Okay.
Getting rid of pimples on your back, you can use a salicylic acid spray. There's one by Acne Free. They make a really nice one. Also, Differin makes one. It's called a salicylic acid spray, and it can spray through 360. You can spray like on your back, help prevent blockage of pores. And then also use panoxyl, which can help kill acne bacteria.
Whose TV you on?
Hostile Guardian is active.
Gas is closing in.
So, ammo refill right there.
Okay, yep, good call.
Your squad mate has intel revealing the location of the next gas spread. Secure them to the uplink station marked on your TAC map for decryption before it's too late.
I don't know if I zip over there. That's getting in too close.
There's nobody over there.
Your squad made it to the safe zone.
Yeah, pretty
How
right.
does that not hit? Somebody just dropping in.
Flanking here.
So let's see. Echo says, what's the main anything we do religiously to keep their skin healthy? So Echo, by far, the most important thing that you can do. That guy's down, by the way.
One more tunnel.
Be attacked by an enemy squad. Evade and survive.
The most important thing that anyone can do is sunscreen every single day.
That squad. Hunt them down.
I got you a loadout when you come back, Dylan.
I'll get mine.
Squad mates redeploying. Well done.
I got the one guy done.
Enemies
Finished.
are dropping into the area.
I'm dropping in. Finish him.
We located the rest of them.
Oh, he's chasing me.
Fire. Nothing's happening.
I need that help.
Help you?
Oh, he got me down. I have self. Nope, he's on my body. Never mind.
Prices are adjusted. Couple contracts out there having great payouts.
So,
No way,
yeah,
dude.
sunscreen's the most important thing. A great retinoid or retinol at night is the next best thing you can do. So sunscreen by far is the most important. I found a fairly solid link between eczema and diet, but it's more complex than what people think. You got to break down eczema into 3 different skin-related things to figure it out. It took me hard to find it, but it was a fun rabbit hole to go down. So are you? I guess you're probably saving it mostly for the book, huh? Man, I'd really like to get back to that area, but I don't think it's safe, bro.
Whoa.
Everybody's down. No, it's way hot right there. I had a loadout marker there too on my body.
It's all on you. Stay alive so your
Yeah,
squad can
I don't know what we
redeploy.
have to
That's 2
do.
teams, yeah.
Yeah, it's kind of hot there. There is a buy. There's a fire cell right now.
Nice.
Gotta get a little extra dough.
You've got
Belong's
reinforcements
back.
inbound.
If you guys have the money, Belong, I don't know how much a loadout is right now on the fire sale. It's 6,200. I'll drop the money. think
Got cash here.
I don't know if we have enough though.
Alright, your squad's in the safe zone.
There's a little bit more. Drop a little bit more behind you. Yeah, you have enough.
Soldier incoming.
Another one just dropped.
Fire sale's done. Prices are back to normal. Loadout drop headed your way.
And then Jackson, there's custom here for you too. A custom beater.
Got it.
Going to the roof. So I'm on edge about Accutane. What should I do it? Completely up to you. You got to talk to your doctor. Personally, I believe that Accutane is the best thing for acne and the only thing that can cure acne permanently. So I'm a big fan of Accutane, but you got to do what's right for you, man. You know, talk to your dermatologist. Make sure you get your questions answered. Make sure you're feeling good about it, and then go from there. One down. 2 down. 2 thirsted.
Rock them.
The third guy is over here.
Moving
Right here.
He's down.
Knocked him.
Get some.
3 down. Hello, Shakir. Top of the.
Dang, booty.
Did I scare you?
Shit at me.
That's not me.
Oh, they
Oh.
bought back on the boat. It was me. I downed a guy on the top of the prison, but
You're losing
they're buying
ground.
back on the ship.
Oh, somebody's looking at us. Left side.
There's a whole team back on the boat. Sadly,
All squad members are in the safe zone.
Enemies deployed a counter UAV.
so annoying.
You didn't look at that again? Don't know where from.
There's guys coming down out of prison right now.
Right here.
There's 2 of them. Nice job.
Guy dropped on me.
Nice
I
finish.
killed him though.
Good job. Yep.
Right here. Somebody get him.
On me.
Roger. Yep. Squad wipe. Bulong's down. You got the money, Jackson, if you can get to the buy and get him.
Right behind you, right behind you. The front.
Yeah, the buy. Yeah, I'm putting smoke on it for you. Friendly. There you go.
Gas is inbound. Some of your squads outside the safe zone.
Oh, come on. They're buying back behind us now.
2-1.
Got 1 down on the behind us. Is that the guy you're talking about?
Yes.
Good. He's down. We haven't looked at everyone though.
Into the AO.
Problem is he's gonna get back up.
Got a gas line.
Yeah, okay, I got that guy thirsted. They're flying to the boat again.
Cracked him. Cracked him in the gas.
Oh! He's on my roof.
High-value contracts are in play. More risk, more reward. Advise you head to the safe
He's on the roof.
Yep, he's on the
Yeah,
roof
he's on
with
the
me.
roof. He's on the roof.
I got him down on the roof. Multiple times.
Oh!
No, they're all weak. They're
They're
all
on the
weak.
buy, they're on the buy.
Ah,
Damn, they were so weak too.
dang.
Only 10.
Oh, dude, we ran it at the end too. Gosh, we did so good.
I put 50 bullets in all 3 of them.
Yeah, they were
all weak.
soft.
Riker 9, dude. That thing shoots really fast.
Yeah, it's
Shoot,
really, really nice.
It's clean.
Is it Teo Soleimanis? Who is that? What's he do? Topical skin or topical steroid withdrawal or something? Is that what he does? Is that his thing? Or no, he was on Huberman recently. Oh, sun powder. Oh, okay, gotcha. No, I've actually done videos on sun powder. I knew Dr. Abruk that works with Soleimani, but I didn't know, but I actually didn't know SwoleMD. So I think that's great. Definitely doing that, Ethan, as an option for protecting your skin. Obviously, it's not going to do as good as sunscreen overall, but I think it's a really, really nice option. But I want to say, hey guys, now's the time. If you guys don't follow, make sure to follow. Give me a follow on, a subscribe on YouTube. I appreciate you guys being here. Make sure to tap the bell. You guys have been awesome. So thank you guys so much. I appreciate it. I would disagree. I don't think that skin cancer is mostly genetic by any means. I think the sun plays a drastic effect, and that's why we see people with a very significant amount of sun exposure, like farmers and construction workers, with a much, much higher incidence of skin cancer. So if that's his take on it, I mean, I disagree with that, but I think that sun powder and some of those polypodium extracts can be a nice adjunct to sun protection. But make sure to subscribe, guys. If you don't subscribe, I'm going to hop off here. It's been a wonderful time with you guys. So thank you so much for being here. And if I didn't get your question, all you have to do is pop over to my most recent video on YouTube and drop it there. So Alistair, thanks. Good to be here. Ethan, it's good to see you here. You guys are awesome. Thank you. Thank you. You guys rock. I'm going to shut the stream down for now, and I'll see you back soon. So thank you so much.